is Dr. Thomas Infernuso from the Animal Surgical Center, and the topic for this week is hip dysplasia in dogs. So hip dysplasia, what that is a mismatch between two bones. So the joint is made of, in this case as far as the hip, a cup, and then you have a ball. And when those two bones are not fitting perfectly, you had a misfit, a mismatch, and that leads to an abnormal stress over the surface, which is the cartilage, and that leads to cartilage wear. As the cartilage tears, what you're going to be ending up with is bone on bone. As you guys know, bone on bone leads to bone spurs and then arthritis. And then eventually, this hip will be scarring down and then it's going to lock. And that creates a lot of pain. And that is usually what hip dysplasia is about. Now, in regards to diagnosis, how clients know that patients have hip dysplasia is about clinical signs. So most often it's diagnosed in young dogs, 5-6 months of age. Often they have difficulties in rising, laying down. They're stiff in the morning. They don't want to go up and down the stairs. And a lot of people say, well, my dog sways a lot. It's very wobbly. And on top of that, he doesn't really want to jump on the couch, which is absolutely unheard of, because puppies are crazy. They can do anything. They should be able to do anything. So bunny hopping, wobbly, and all these changes are consistent most often with hip problems. How do you diagnose? You get an x-rays. X-rays is a physical examination. If you can pop the hip out and you can see on the x-rays the degree of what we call subluxation, which is how far out the hip is, that indicates that it's not a proper fit. Now, how do you treat it? There are two different theories. You can treat it medically or you can treat it with surgery. Usually medical management is okay because the conformation is off, but supplements, weight management, controlled activity, that helps big time, but eventually they will require surgery. So surgeries, there are different options. Total hip replacements is a great option, very expensive, and unfortunately at times can be pretty troublesome because of the complications associated with that. The other alternative is called FHO, which is the femoral head, which is the leg bone, the ball, that we actually remove it. So here's the cup, here's the ball. Now the ball is doing this, it's creating a lot of trauma. So what you do, you remove the ball. So you do an ostectomy, so removal of the head of that femur. And then what you do, you create a little gap. That gap is going to fill in with scar tissue. And because scar tissue is very flexible, it's going to reestablish the range of motion. Because scar tissue does not have nerve endings, there is no pain associated with that. And that is the reason why a lot of these dogs with these FHO surgeries do very well. Now, the prognosis is excellent. With total hips, FHOs, and there are other surgeries that can be implemented as well. So the prognosis is very good if they're done earlier and the muscle mass is not super atrophy. And of course, all the style clients, early intervention, better, because prevention of potential changes later on will provide a better outcome. Thank you for today. Please follow us up on social media, Facebook and Instagram. Have a great day.